While syringes are the most commonly used device for delivering insulin, there are new products on the market today that offer more options for how and when to take your insulin. Insulin syringes inject insulin using a thin, disposable needle. If you use a syringe, your diabetes educator will show you how to prepare for and give yourself an injection. Insulin pens inject insulin using a needle a lot like a syringe, but pens contain a cartridge of insulin so that you don't have to fill up the pen with insulin the way you do with a syringe. Some pens are pre-filled with insulin and discarded after all the insulin has been used. Insulin pumps use a catheter to deliver rapid-acting insulin continuously into your bloodstream. This makes taking insulin more convenient because you don't have to give yourself injections multiple times a day. The tubing remains in place and is changed every 2 to 3 days. Insulin pumps are used by people of all ages with type 1 diabetes, and people with type 2 have also started to use them. Insulin pumps can help you keep your blood glucose levels within a healthy range throughout the day and night. However, using a pump is a significant adjustment. Before you decide to use a pump, you'll want to talk with your doctor or diabetes educator to weigh the advantages and disadvantages. Your insulin shots will work best if you time them so the insulin can work as soon as the glucose from your food starts to enter your blood. Regular insulin, for example, is most effective if you take it 30 minutes before you eat. Insulin enters your bloodstream at different speeds depending on where it's injected in your body, and this affects your blood glucose levels. Insulin works fastest when it's injected into your abdomen, more slowly in the upper arms, and even more slowly in the thighs and buttocks. You'll get the best results from your insulin if you inject it in the same area of your body at the same time each day. But don't inject it in exactly the same spot each time, as this can cause hard lumps or fatty deposits under your skin, which make it harder for the insulin to do its job. Injecting insulin properly takes some planning and work, but fortunately, many of the newer devices make it a much easier and more discreet process.